So we have here Dr. Shikora, Dr. Weber, and myself, and we are putting together protocols related to managing chronic diseases, which specifically cancer and degenerative diseases and autoimmune. I think Dr. Weber has put together these protocols along with involvement of Nitromedicine, myself, and also Dr. Shikora, which is here. He is also developing the diagnostic system to detect cancers, which is going to be the ultimate sensitive cancer testing out there. So Dr. Weber, what your, in summary, the headlines of what you have been done and your vision about a little about your project that's coming up.
Yeah, hello. My name is Dr. Michael Weber. We are here in Weber Medical Facility here in Germany. Since about 15 years, we are working on different laser products. We have developed different new laser systems for external laser therapy, what people use for acupuncture or maybe pain management. But also we have developed invasive laser systems, what will be used for intravenous laser therapy, what is very interesting today to bring more energy in the bloodstream, to give treat chronic diseases, improve the microcirculation, give energy to the mitochondria, especially in older people also with the degenerative diseases. On the other hand, also we have developed interstitial and intra-articular laser therapy. So today we are able to bring laser light with all different wavelengths right into the joints or into damaged tissue to induce regeneration of the tissue. We can even enhance this effect by additional use of platelet plasma, for example, with all these anti-inflammatory cytokines and growth factors. We also make stem cells from adipose tissue, what we can inject in damaged joints, for example, what we also can give intravenously. We have also set up a new method for direct bone marrow irradiation to stimulate the bone marrow stem cells already. Another field what we are working on is cancer therapy. We have developed new fields of photodynamic therapy. We have developed new photosensitizers, especially nanoparticle indocyanine green, which works with infrared lasers. So today we are able to treat all cancers, also deep in the body, for example, liver metastasis or even brain tumors. And that's our field, what we want to develop further in the next year. In the next years, all these regenerative methods on one hand, but also the field of photodynamic tumor therapy, and I think there's a lot of things to do in the next years, but with my great help from Dr. Alaza here, my long years friend, and Dr. Shikora, we are working together on all this diagnostic, but he will explain himself. We have a lot of big plans for the next years.
Great. What about Dr. Shikora, about your very unique cancer detective system, which is going to beat the MRI and CT scan, because it's not about the density of the cancer, it's about detecting the spectrum from the photosensitizers of the cancers that's accumulating inside the cells. So you are detecting more of cancer cells in the bloodstream, right?
Yeah. The basic motivation for our development was this a very simple problem. Today we call early diagnostic of cancer if we see a tumor in an MRT or in an ultrasonic or PET or something like that. Early diagnostics in a moment means we are able to detect tumors which have a size of at least, roughly speaking, 1 millimeter. A tumor of 1 millimeter consists of at least 10 to 9 cells. Our idea was to develop a system which is able to detect one single tumor cell. And if we are able to detect one single tumor cell, so we can speak about early diagnostic. This is a real early diagnostics. That was the idea behind. And there is a very simple way. It is very well known that the physical method which has the highest sensitivity is spectroscopy. With spectroscopic systems, we are able to detect one photon, and we are able to emit one photon. So, and from these two ideas, we developed a spectroscopic system which can be used for the diagnosis of single tumor cells or some small conglomerates of tumor cells. We can study we can measure the concentration of tumor cells in a blood stream, so that we are able to say after a chemotherapy, does the patient have remaining tumor cells in the blood or not? And if we detect some remaining tumor cells in the blood, we can destroy them by means of photodynamic therapy very easily. And this is the background of what we did. Yeah, we have a device, a diagnostic device system, which is in principle ready for clinical use.
Great. I think we are working on perfecting the protocols, integrating all those
yes, of course,
scientific data, and I think we are in the final stages, and it is also commercialized already, as a prototype. But of course, it's going to be advanced and upgrade, and I think it will be launched completely. I think in years from now, maybe 2-3 years, as something that's going to be FDA approved and CA soon. Okay, well, thank you very much, and hopefully we'll meet in the conference that's coming, which is the ESLA next year.
Yeah.
And we're going to report all the progress and advance that we are working together
And
with.
we will all present at ISLA conference.
Right.
You will present and you will present.
We're going for, you have Las Vegas, right, in April?
Las Vegas is in April. On April
Okay.
7, we get a special award from this group from Hollywood, for breakthrough in medicine. So
Beautiful.
And on the weekend before, I think it's the 4th or 5th of April, we will organize a big U.S. conference.
Okay,
international conference.
So I'll be expecting all the doctors of my network to be attending, and we'll be sending you all invitation letters, and hopefully we'll meet all together there again. Thank you very much.
Okay.
Bye.